Part of what we do at Intellectability is provide information and tools and training to people who support people with intellectual and developmental disabilities. One of the things that we did is we created a document, actually a couple of documents, called The Great Outdoors. We have a warm weather edition and a cooler weather edition. And as we are moving out of winter right now and moving into summertime, we're going to talk about warm weather tips and precautions as we move more to doing activities outside. So one of the first things to think about is sun protection, right? So did you know that you can get a sunburn in as little as 10 minutes? And again, when we have a different ability to communicate what we're feeling, we may not be able to communicate to someone that, hey, the sun's feeling really hot, or I'm sitting out here too long. So as supporters of people with disabilities, we need to be aware of these types of things. So we should, consider limiting sun exposure around the hottest parts of the day. Usually between 10 a.m. and 2 p.m. is when the sun is just, bearing on you. Always make sure to use some sort of sunscreen, preferably one with a SPF, which is a sun protection factor, greater than 30. And reapply that sunscreen every couple of hours because it can come off if the person's sweating, especially if there are water activities. So it needs to be reapplied. You probably know this, but there's clothing also that has sun protection factor ratings as well. And using clothing that can help reduce the sun exposure can help reduce the incidence of sunburns as well. Wearing hats, using umbrellas, things like that should be considered also. Another really important part of being aware of what the sun can do is that there are a number of medications that can increase the risk of having some sort of sun exposure or sunburn or skin irritation from the sun. There are some antibiotics, some antidepressants, antihistamines, some blood pressure medicines, antipsychotics. All of these things, or some of these medications, can affect the way a person cools themselves off. It can affect sweating and also your sensitivity to the sun. So consult with your pharmacist or physician to look at what potential medicines could cause problems with people in the sun. So we're going to talk more about the Great Outdoors Warm Weather Edition in the next edition of Medical Monday.